राजस्थान में कैंसर के बढ़ते मामलों को रोकने, लोगों के बीच जागरूकता फैलाने और इस विषय पर बातचीत को बढ़ावा देने के लिए न्यूज 18 नेटवर्क की पहल संजीवनी यूनाइटेड अगेंस्ट कैंसर के तहत ट्रीट टू बीट राजस्थान टाउन हॉल का आयोजन किया गया, जिसमें सरकार, पॉलिसी मेकर्स और डॉक्टर्स ने हिस्सा लिया और कैंसर की रोकथाम, ट्रीटमेंट और कैंसर केयर पर चर्चा की। कार्यक्रम की शुरुआत हुई नोवार्टिस इंडिया के कंट्री प्रेसिडेंट और मैनेजिंग डायरेक्टर अमिताभ दुबे के वेलकम एड्रेस से।
Breast cancer has become the most common malignancy among women, accounting for approximately 27% of all cancers. In Rajasthan alone, the prevalence of breast cancer has been rising steadily, with an estimated 11,000 new cases reported every year. These numbers make our deliberations today absolutely vital. As we all know, cancer survival becomes more difficult in the later stages of the disease, and more than 50% of Indian women suffer from stage 3 or stage 4 breast cancer. Post-cancer survival for women with breast cancer was reported at 60% for Indian women, as compared to more than 80% in the US. These statistics demand action, and it is our collective responsibility to address this pressing issue. Closing this gap is directly in line with the purpose of Novartis to reimagine medicine, to improve and extend people's lives. It is our absolute honor to initiate our first state-level engagement and dialogue today with the progressive state of Rajasthan. Within Rajasthan, it is heartening to witness that the government's steadfast commitment towards the well-being of its citizens, particularly in the realm of healthcare. Rajasthan has always been at the forefront of expedited process of including newer therapies in government hospital formularies so that patients can benefit from these life-prolonging treatments. We need to ensure that these are not limited only to a small number of patients, and how we can work together to provide it to more number of patients. In conclusion, many call breast cancer as a good cancer. Any form of cancer can be debilitating and devastating to patients and their loved ones. Unlike diabetes and chronic diseases, where patients have to take medicines and live with the condition lifelong, in cancer, they can be cancer-free if detected early. Early detection and more suitable treatment is the key for being cancer-free. Today, there is a whole new paradigm of treatments that provide the opportunity to patients to live longer and better lives. This is the positive, hopeful attitude we need to have as we look ahead for treat to beat.
अपने निवासियों के सेहत के लिए राजस्थान सरकार प्रतिबद्ध है, लेकिन कैंसर के मामलों को रोकने के लिए उनकी क्या तैयारियां हैं? इस विषय पर चर्चा की राजस्थान के स्वास्थ्य मंत्री श्री गजेंद्र सिंह खीमसर ने।
What is your larger vision when it comes to really implementing the fact that every citizen, no matter what economic strata he or she might be from, has access to accessible and affordable healthcare, and of course, we can then come to cancer as well.
I'd like to thank News 18 and the partners Novartis for having invited me to this brainstorming session and for a very noble cause, the silent killer cancer. There are 2-3 very important things I want to share with you. One is the Ma Yojana, which was earlier on conceived by our government with Vasundhara ji as the CM. It was known as the Bhamasha Yojana. The seed was sown for ensuring people, giving them good free health checkups. Then it became the Chiranjeevi Yojana, and now it's become the Ma Yojana, MAA. This is Mukhya Mantri Arogya Yojana, it says. So the Ma Yojana is today effective. Now what my focus has been, and we are working on it very hard, is when I talked about public-private participation, I mean that today all what we need to do is strengthen the finances we can give to the insurance agency. If you see, there are three players. One is the patient, one is the insurance agency, and third is the empaneled hospital.
Right.
This is how things flow. 70% of our population resides in the countryside, in the villages. Out of this 70% population, 45% are women. I talked to my department and all the ladies out there, all our IAS ladies, I said, I would like to have vans equipped with mammography and pap smear and have them go into each village and each dhani. Dhani are hamlets. Department on its own has started this, what I would say, abhiyan, with vans going on divisional headquarters. Now we have the old major 7 divisions, Bikaner, Jodhpur, Ajmer, Kota, Udaipur, like that. So we are still touching the tip of the iceberg. What we want to do is we want NGOs and even hospitals, who are doing well. Why don't you do public-private participation? You have a van with all the equipment. Our doctors, when you go into the countryside, our ANMs, our doctors, they will give you a backup to go into each village, and that team will be with you. But you will be monitoring your vehicle and all that and equipment. And I think if that can work out, then fighting cancer, you can do it.
What are some of the things that you, as part of the government, would like to undertake over the next couple of years to ensure that cancer, and particularly breast cancer, is something that, a developed India has a grip over?
See, we are creating the infrastructure of more hospitals, more district hospitals, more sub-district hospitals, more medical colleges, more CHCs, more PHCs, more sub-centers. We are trying our best. But even the private enterprise also has to play a role in it. आदमी जो अपने खुद का well-being के बारे में नहीं मालूम है, you can imagine how primitive the thinking and how casual the thinking is, which we have to change their mindset.
Yes, and that will be a collaborative effort.
राजस्थान सरकार अपने निवासियों तक बेहतर कैंसर केयर पहुंचाने के लिए क्या-क्या कर रही है, इसके बारे में बताया राजस्थान मेडिकल सर्विसेज कोऑपरेशन की मैनेजिंग डायरेक्टर नेहा गिरी ने.
There have been some significant strides in terms of trying to improve cancer care in the state. Give us an overview of the holistic strategy that you're putting in place to fight cancer in Rajasthan, and particularly then breast cancer.
We have a lot of screening that has been done in oral cancer, regarding breast cancer, and obviously cervical cancer. So apart from this awareness and information dissemination camps, these screening camps, we have a whole infrastructure regarding cancer care treatment. First is obviously the government medical hospitals, medical colleges, district hospitals, community health centers, and even now the screening is being done also at the sub-center level. Under the Mukhyamantri Nishulk Dawa, Nirogi Dawa Yojana, we are procuring more than around 200 drugs per year. And we are spending around 7 crore on it. That's our budget. So we are assuring that these drugs are available free of cost to patients in the residents of Rajasthan. Apart from that, we have developed a good cancer facilities, diagnostic facilities are developed now at our various medical institutions, government medical institutions. So a lot is happening. And obviously these things are this is a continuous process. We are continuously expanding our ambit whether in drugs, whether in treatment, whether in reaching to the ground level. And Rajasthan is having the highest coverage, insurance coverage right now, 88%, which is a very high number across this country. And we have so many packages for cancer care treatment.
राजस्थान में कैंसर के इलाज के क्या विकल्प हैं? इस पर चर्चा की स्टेट कैंसर इंस्टीट्यूट एसएमएस हॉस्पिटल जयपुर के मेडिकल सुपरिंटेंडेंट और डिपार्टमेंट ऑफ मेडिकल ऑन्कोलॉजी के हेड डॉक्टर संदीप जसूजा ने।
कैंसर केयर के फील्ड में बहुत टाइम से काम कर रहे हैं। आपको क्या लगता है कि राजस्थान में कैंसर ट्रीटमेंट और कैंसर केयर के लिए क्या-क्या किया जा रहा है? क्या-क्या इनिशिएटिव्स ऑलरेडी लिए जा रहे हैं?
Today, I can say even in government setup, name the treatment. Name the treatment which is available in the India. And this all treatment available in our state cancer institute, in our SMS hospital, in government hospital, in Apex institutes. Name the treatment in terms of chemotherapy, in terms of radiotherapy, in terms of bone marrow transplantation, half match, full match, autologous, in terms of surgical oncology part, palliative treatment. So everything is available in the Apex Institute. Private partners, they are also well developed now. They have very good infrastructure now in Jaipur and peripheral side like Udaipur, Jodhpur, and they are also taking care of good chunk of patients, providing free of treatment cost to them in our Ma Yojana and our RGHS patients. And these are practically, for Rajasthan population, practically this everything is free of cost available to all patients, including targeted therapy in Rajasthan, Nirogi Rajasthan Yojana, including costly, one of the costlier drugs like lung cancer, breast cancer, free of cost to them. And now government is very sensitive on this issue. So they have made it Rajasthan integrated task force. Recently we have one meeting for that task force, and we have decided to do, government have decided to work upon on prevention, awareness and detection and management.
अभी एक ब्रेक के लिए रुकते हैं। ब्रेक के बाद देखिए राजस्थान के जाने माने मेडिकल एक्सपर्ट्स का पैनल डिस्कशन। ट्रीट टू बीट के मंच पर राजस्थान में कैंसर के खिलाफ लड़ाई में अहम भूमिका निभा रहे मेडिकल एक्सपर्ट्स ने एक इंसाइटफुल पैनल डिस्कशन किया जिसका टॉपिक था ट्रांसफॉर्मिंग ब्रेस्ट कैंसर केयर, जिसे होस्ट किया छवि मित्तल ने, जो खुद एक ब्रेस्ट कैंसर वॉरियर और एक्टर हैं।
Looking forward to this panel. This is a cause which is very, very close to my heart. Dr. Asim, I'm going to straight jump into this and ask my first question to you. राजस्थान में जो कैंसर इतना बढ़ रहा है उसके बारे में आप क्या कहना चाहते हैं? एंड भगवान महावीर कैंसर हॉस्पिटल और रिसर्च सेंटर इसके बारे में क्या कर रहा है? व्हाट आर द इनिशिएटिव्स बीइंग टेकन, उसके बारे में बताइए।
Since like 27 years, Mahavir Cancer is working in the field of cancer. Recently, in 2020, we have one large project of Cancer Jaanch Aapke Dwar, and where they have screened like 20,000 village population, and they found a good number of the cancer patient out of them. And the thing is, if they can't reach us, we should reach them. And the only thing which we can do is the awareness, to increase awareness. How it will be possible? My two suggestions: you make our textbook of the children education since from beginning, like 9th standard. The female population is around 14 years old. If you talk about in the textbook what is the cancer, what is the breast cancer, what is the cervical cancer. If we want to discuss about the breast, why we are so much ashamed about that? So this is the thing why we are not getting through it, and why our target are not fulfilled. The initial education is not talked about that.
आई थिंक व्हाट यू सेड इज रियली गुड कि आप बात कर रहे हैं ब्रेस्ट कैंसर की, लेकिन आप ब्रेस्ट की बात करने से कतराते हैं। और आई थिंक वुमेन ऑल्सो जिनको ब्रेस्ट कैंसर होता भी है वो खुद भी इस बारे में बात करने में बहुत हिचकिचाती हैं। कमिंग टू यू डॉक्टर मनीष, आपसे पूछना चाहूँगी कि कॉमन सा सवाल है जिसका जवाब हर कोई ढूंढना चाहता है, ये ब्रेस्ट कैंसर होता क्यों है और क्या कुछ ऐसे स्टेप्स हैं जिन्हें लेकर हम ये इंश्योर कर सकें कि हमें ना हो या हम सेफ रहें ब्रेस्ट कैंसर से?
तो बेसिकली कुछ परसेंट ऑफ पेशेंट ब्रेस्ट कैंसर के तो जेनेटिकली लिंक्ड है। अराउंड 10 to 15% पेशेंट हैव सम काइंड ऑफ genetic mutation which predispose them for acquiring this cancer at early age, or they are at a higher risk of acquiring the cancer. उसके अलावा अराउंड 85 से 90% पेशेंट्स हैं, उसमें डिफरेंट रिस्क फैक्टर्स हैं जो कैंसर होने की संभावना को बढ़ा सकते हैं. सम ऑफ देम आर एज, so you can't help with the age. With increasing age, the chances of acquiring cancer increases. Besides that, the factor which you can modify are your weight. So obesity has a direct link with the increasing your risk to cancer. Then also consumption of alcohol is one of the modifiable factor which is linked with the breast cancer along with some other cancers also. So these are some of the factors which we know that these predispose that particular person more for a cancer.
So just staying away from those factors should help. Okay, Dr. Suresh, आपसे पूछना चाहूँगी कि गवर्नमेंट, राजस्थान की जो गवर्नमेंट है वो समय समय पर इनिशिएटिव्स और स्कीम्स के ज़रिए कोशिश कर रही है कि कैंसर की फील्ड में बहुत प्रोग्रेस हो. तो एसएमएस हॉस्पिटल में जहाँ पर राजस्थान के सभी जो पेशेंट्स हैं उनका इलाज होता है, वहाँ पर जो कैंसर की जो सर्विसेज हैं, फैसिलिटीज़ हैं, सुविधाएं अवेलेबल हैं, उनके बारे में कुछ बताइए.
गवर्नमेंट ने कैंसर के ट्रीटमेंट के लिए बहुत बड़े स्टेप्स लिए हैं और कैंसर के ट्रीटमेंट के लिए जो स्टेट कैंसर इंस्टीट्यूट है, एक सबसे बड़ी अचीवमेंट गवर्नमेंट की जो है कि स्टेट कैंसर इंस्टीट्यूट बनाया है और उसका एक्सपेंशन भी अभी रिसेंटली हुआ है और 6 फ्लोर और बन रही हैं. उसमें लेटेस्ट एडवांस्ड मशीनें उसमें इंस्टॉल हो रही हैं. रेडियोथेरेपी की मशीन्स आई हैं जो कि काफ़ी अपने आप में सबसे एडवांस मशीन्स हैं. एडवांस्ड ड्रग्स हैं जो कि फ्रीली अवेलेबल हैं.
दैट्स अमेजिंग टू हियर, क्योंकि ज़रूरत है, अगर केसेस बढ़ रहे हैं तो फैसिलिटीज़ बढ़ना भी ज़रूरी है, तभी तो बैलेंस मेंटेन होगा. कमिंग बैक टू यू डॉक्टर असीम, टारगेटेड थेरेपी की बात करते हैं. How do you view the role of targeted therapies in advanced cancer treatment, and how is it being integrated into the care protocols at your center?
The breast cancer cell can have three kind of the target. There are the 2 hormone receptors and one is the HER2 positive or negative. So if you have a HER2, there is a membranous receptor over the cell of the breast cancer. We have very good drug and n number of the drugs are available nowadays to target that cancer cell. Once we give the injection in the patient's vein, drug goes directly to the cancer cell and attack over the cancer cell, not over the general body cell. So we can prevent the side effects. And what happens is, if you target the right cancer cell, then cancer cell will be all destroyed and patient will be cancer free.
So this kind of progress that the field of cancer is making, I think it is so important for people to know about it. तभी तो डर लोगों के दिलों से निकलेगा. डॉक्टर मनीष, रेडिएशन ऑन्कोलॉजी में भी बड़ा प्रोग्रेस हुआ है, तो राजस्थान में उसकी वजह से क्या डिफरेंसेस आप नोटिस करते हैं?
The first thing which happened is that the radiation facilities in Jaipur has doubled. So we have more centers where you can get this treatment. Radiation is an important part of CA breast treatment. So number one is that the facility is increasing. जयपुर में डबल हो गया एंड इट स्टार्टेड इनटू कोटा, जोधपुर, बीकानेर, प्राइवेट सेटअप भी आ रहे हैं. सो द पेशेंट्स आर गेटिंग centers near to their homes. Important thing which I feel is that the course of radiation is now reduced. Hardly what the development which I have seen is that particularly for left-sided breast treatment where the heart lies in close proximity to your treatment area. So there are new techniques where you can spare the heart. So some of the chemotherapy causes cardiotoxicity, and then you don't want your radiation to add on to that cardiotoxicity. So there are techniques where you can effectively spare the heart of the patient when the breast is, the cancer is on left side. So that another good achievement is there.
Thank you so much for sharing that, doctor. And I think the experience that I also had with radiotherapy was very, very good. It was much better than what I was expecting. So firsthand, I can say that there's been a lot of advancement. And unfortunately, we're running out of time. But Dr. Suresh, मैं आपसे एक बहुत ही important सवाल पूछना चाहती हूँ before we end this session. जो महिला, जैसे अभी पता चला है कि मुझे ब्रेस्ट कैंसर हुआ है, उससे आप क्या कहना चाहेंगे? जो घबराई हुई है, जिसके सामने कोई ऑप्शंस उसको नज़र नहीं आ रहे हैं और दुनिया जहान के जो टैबूज़ हैं उन सबको वो फेस कर रही है, उन ऐसे लोगों से आप क्या कहना चाहेंगे?
सबसे पहले तो उसको ये अश्योर करेंगे कि ब्रेस्ट कैंसर इज़ अ क्योरेबल डिजीज़ if it diagnosed earlier, it is totally curable. एंड जो पहले एक हेजिटेशन था कि अगर ब्रेस्ट कैंसर है तो पूरा ब्रेस्ट रिमूव हो जाएगा, आजकल एडवांस मेडिकल रेडिएशन और सर्जिकल टेक्निक्स की वजह से ब्रेस्ट को रिमूव करने की मैक्सिमम केसेस में ज़रूरत नहीं पड़ती है. जो एडवांस सर्जिकल प्रोसीजर्स हैं, टेक्निक्स हैं, उनसे मैक्सिमम पेशेंट्स में आप ब्रेस्ट को सेव कर सकते हैं. सो रीएश्योरेंस बहुत ज़रूरी है. किसी भी जो भी पेशेंट सबसे पहले आएगा उसको ये एश्योर करेंगे, उसको ये विश्वास दिलाएंगे कि दिस डिजीज़ इज़ क्योरेबल विद द एडवांसमेंट ऑफ मेडिकल रेडिएशन एंड सर्जिकल ऑन्कोलॉजी.
Well, thank you so much. This panel discussion was very, very insightful, and I want to leave everybody with the thought that medical fraternity तो काम कर रही है कैंसर से सबको बचाने के लिए, लेकिन हमारा भी फ़र्ज़ है कि हम forthcoming हो as somebody who's suffering from cancer or as somebody who needs to do the self-examination or any kind of screening, वो भी ज़रूरी है, and it's a combined effort. We all have to make it. Thank you so much for joining us.
संजीवनी यूनाइटेड अगेंस्ट कैंसर के तहत ट्रीट टू बीट का मकसद है देश के हर नागरिक को उनकी सेहत के प्रति जागरूक करना और कैंसर केयर से लेकर ट्रीटमेंट तक की पर्याप्त जानकारी पहुंचाना. ऐसी खास पेशकश लेकर आपसे फिर मिलेंगे. तब तक अपना ध्यान रखें और याद रखें, कैंसर से डरना नहीं, उसे हराना है.